The categories of patients that we are treating are the patients with 1 or 2 agenicias. The most common agenesia to have for a patient is the lower second premolar. And the second most common is the upper laterals. And these are the patients that we see quite a lot of and treat on a daily basis in our clinic. We also have the categories with the multiple agenicias. And these can be either just the regular oligodontia patients that are lacking a few teeth here and there, but it can also be the patients that suffers from different kind of syndromes, like for example ectodermal dysplasia. Ectodermal dysplasia is a genetic defect that affects the ectodermal structures in your body. So these patients don't only have problems with lacking a lot of teeth and also have very specific shapes of their teeth, they also very often have problems with their skin, their hair, their nails, and their sweat glands.